The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I'm Dr. Paramjeet, you're watching Dr.Education. Welcome back to my channel, and today we are going to talk about tinnitus. Yes, you have heard that ringing sound in your ears sometime or the other. Everyone actually has heard that tingling or some sound in their ears, and you must have thought, okay, it's something like some air is leaking somewhere, air is escaping, or maybe there is some water running, maybe there is some seashell blowing, or maybe there is a musical note which is going on somewhere, but you are hearing some sound in your ear. That is tinnitus, which actually nobody else is hearing but you. So if you have ever heard that sound, or you might be hearing that right now, you have tinnitus. Right. So what is tinnitus, and what happens? Why do you get all this tinnitus, and what causes it, and how can you take care of it? We will be talking about that today. Let's talk about it. Okay. Tinnitus, hearing noises in your ears, right? So most of the times there is no outside source of that sound, obviously. That's why it is something to talk about. All right. And this ringing in the ears, like I said, it can be blowing, a blowing sound, roaring sound, buzzing sound, hissing sound, humming sound, whistling, or a sizzling sound. All right. So it might be soft, it might be loud, and you might feel a lot of things about it, but it is there. And it is very common, and everyone notices at least a mild form of tinnitus once in a while, and that's can last for a few minutes. Sometimes it can be triggered by a tight slap or something like that, but it happens, right? However, if you are having it constantly for a long time, or recurrently repeated number of times, then that can be very stressful for you, and it can make your life very miserable, very difficult. It can make it hard to focus, and even difficult to sleep, right? So remember, it is a subjective thing. It might be subjective or objective. Subjective means that the sound is only heard by you and only you. Objective means that a sound which is heard by you as well as by somebody else, like an examiner using like a doctor using a stethoscope near your ear or your head or neck. In that case, that sound might be heard by a doctor as well, which in that case it is objective. Yes, it is objective, means there is something which is causing that sound inside, right? So what are the causes, right? That's the important question. See, many times the cause is unknown, that what is causing this sound, but the symptom tinnitus can be present because of some actual reason. What reason? Like some ear problem. What ear problems? Number one, ear infections. Number two, a foreign body or a wax in the ear, impacted in the ear. If that is there, that can lead to a sound. Now then, hearing loss. If you have hearing loss, then you might just hear some zzz or some kind of noise, right? That there is something called as inner ear disease, which is Meniere's disease, which involves hearing loss as well as dizziness. You might feel dizzy. You might have even syncopal attacks, right? Then problems of that eustachian tube, which connects your ear to your throat. That tube can the problems having that in that tube can also lead to tinnitus. Now all these things can lead to tinnitus, as well as some antibiotics like and some medicines like aspirin or other drugs can also cause ear noises, and as well as there are some things like alcohol or caffeine, coffee, smoking. They can make these noises worse if the person already has it, right? That's a difficult thing. And sometimes tinnitus is actually a sign of high blood pressure also, or maybe an allergy, or maybe even anemia, low blood, right? Low hemoglobin. This can be a reason. And Sometimes, very rarely, it can be a sign of a serious problem like a tumor or a aneurysm. Aneurysm is like swelling in the blood vessel somewhere, right, in the blood vessel. All right, then there are other factors which can have more risk factors of tinnitus, like TM joint disorders, tympanomandibular joint disorders, diabetes, thyroid problem, obesity, and head injury. If you have these in the past or you have them, then it's possible you might feel tinnitus once in a while. And it is a common thing for war veterans to have tinnitus, or older adults in the age past 65 or older. They might have more common occurrence of tinnitus. But children can also have them. Children can also be affected, and especially those children who have some or severe hearing loss. So what can you do? What can be done? Obviously, see, most commonly tinnitus is noticeable when you go to bed at time, because obviously surrounding is quieter, then you actually notice the sound. So to mask that tinnitus and make it less irritating, a background noise can be used, right? So what can be used? You can use a white noise machine, that is white noise machine, which can mask the tinnitus, so you can sleep and you can get your rest, because it can be very difficult for a person who has continuous tinnitus to sleep, right? Although it won't kill you, but not resting will definitely make some damages, serious damages, right? And then you can run a humidifier or a dishwasher or something like that, so that noise can actually mask this noise, right? So what else can you do? You can actually prevent tinnitus. How can you prevent, or you can take care of yourself? First thing, obviously, you can learn how to relax, learn ways how to relax. Stress is one of the big causes of which increases tinnitus. So whenever you feel stressed or anxious, you can go for yoga, deep breathing, relaxation, exercise, sleeping, eating, drinking water. All these things help. Avoid things that make tinnitus worse, like alcohol, caffeine, smoking. Obviously, enough rest is important. Sleeping is very important, and you need to try to sleep with your head propped up in an elevated position. So you keep one or two pillows below, right? Propped up, head propped up, right? Propped up that way, head. So this basically lessens the head congestion and can make the noise less noticeable, and you can protect your ears and your hearing from further damage by this particular thing. Then if you have you can wear ear protections like ear plugs if you need them, right? And then you can actually play some noise around you while sleeping. That can help. And if at all you have a head injury, history of head injury, if the noise is or the symptom actually increases, you have dizziness, feeling of imbalance, nausea, vomiting, then you have to go to the doctor, right? You have to go to a ENT specialist for further evaluation for finding the reason of that particular thing. Like I said, there can be reasons, right, which can be corrected, right? And if there is an unexplained ear noise that bothers you, even after you have tried all these things, you can still go to the doctor. And if the noise is only in one ear and it continues for several weeks, single ear for several weeks, still you need to go to a doctor, right? That is important. And the doctor will do a few tests. Obviously your hearing loss test, audiometry will be done, both the ears. Your CT of your head will be done, MRI can be done, angiography might be done for your blood vessels. Obviously ear examination will be done, and the treatment is to fix the problem if it can be found, obviously. So evaluation is needed to find the problem, but the objective is to make the symptom go away. And if it can be done just by if it can be done just by removing earwax, then it's well and good, right? But if there is another cause like a TM joint problem, then a dentist might have to be involved. Home exercises or might be done. Clenching teeth or grinding can actually help a little time. So that is one important thing right? Then your doctor can also use many medicines to actually see what is the problem. Maybe over the counter medicines like some drugs, vitamins, supplements can be used, right? Or if you are taking these kind of things, so you have to tell these things to the doctor. Maybe something might be causing you the problem. And tinnitus can be relieved by a few medicines which are available in the market. So your doctor will give you that medicines, and but to remember, no drug works for everyone, so it would be a trial and error kind of a thing. So there are some tinnitus masker which can be worn on the ear, which can help some people. It actually delivers a very low sound directly into the ear to cover the ear noise, and a hearing aid can also help if there is a noise which is obviously if there is a hearing loss, which can do the both the things, it can cover hearing loss as well as tinnitus as well. Counseling can be needed if you actually have a lot of tinnitus and a lot of stress because of it, right? Then there are some other methods which are available, alternative methods which are not proven yet. So you should not go for all those methods which are propagated on the internet. So make sure to talk to your doctor. If you have tinnitus, the best doctor for you is an ENT specialist, right? ENT, ear, nose, throat specialist. So that's all of the information you need about tinnitus, about noise in the ear buzz, which is also called. So make sure to share this information. I'll see you next time. Stay connected and stay healthy.